More than 10 million Americans have osteoarthritis of the knee, a painful condition causing swelling, stiffness, and loss of mobility. This noon, we have Dr. Charles Stewart of Boca Raton Regional Hospital here to explain the condition and tell us about some of the treatments. Thank you so much for joining us.
Good morning, Wesley.
Good morning. So what is osteoarthritis?
Osteoarthritis is defined as a wearing away of the cartilage or surface of a joint.
Okay, and so explain how it's diagnosed and how a patient would maybe know that they have it.
Well, first of all, there are two types of arthritis.
Okay.
We're talking about osteoarthritis, which is the most common arthritis. Rheumatoid arthritis is a whole different ballgame. That's what we call an inflammatory arthritis. That's one that often cripples even youngsters. It hits women in 20s and 30s. Osteoarthritis is the wear and tear, or what we call aged arthritis. It's the most common arthritis we have. And the typical signs in Latin are rubor, color, and dolor, red, hot, and tender. So when people have arthritis, their joints often swell, they become very painful, and they're unable to perform the activities that they like to do.
And so how do you treat it?
The treatment is divided according to the severity of the disease. And the first is activity modification and weight loss. If you weigh 280 pounds, then you need to lose some weight. If you're a runner, you may have to stop running. And that hurts a lot of people when I tell them that. I have been a runner myself. I can understand the addiction. But there are alternatives. You can ride an exercise bike. You can do the elliptical, ride a bike, and swim. So I want people to exercise. My motto is motion is lotion. We want you to do something because the joints don't do well when you stay off of them. People do better when they do gentle exercise. Next thing is cold. If your knee or shoulder swells, ice it down. For many people, that's dramatic how that helps. So activity modification, looking at your day schedule, what are you doing that may be aggravating this? Icing it down. Some people take anti-inflammatories, Advil or Aleve, although there are some potential side effects from those. We often inject steroids. Steroid injections can be dramatically helpful for arthritic joints. There are other medications called hyaluronic acid, and when ultimately it gets terrible, a knee replacement or other joint replacements.
Is the condition hereditary?
There is a hereditary component. We haven't traced it down like diabetes, but certainly if your mother and father had arthritis, you're likely to have arthritis. But the most common reason for arthritis is obesity and early sports. I just operated on a young lady, 31, who played volleyball at your alma mater, and she has a terrible knee at 31.
Oh, goodness.
From her sports.
So it could be any age, so just see a doctor if you think that you're experiencing some of the symptoms?
If your pain interferes with your daily life.
Okay, thank you so much for joining us. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.